a condition like endometriosis, it's chronic and it's inflammatory. So certain things make it worse. Certain foods make it worse for different people. It's not everyone. Certain exercise makes it worse for different people. So there's still a lot of unknowns when it comes to how endometriosis is diagnosed and treated because it's different in every person. And also, this is my experience, as a patient. I'm not a doctor. So if you do suspect you have endometriosis, please talk to a medical professional.
This is the Two Healers podcast, where we explore health and wellness through a holistic and integrative lens. I'm your host, Dr. Adri Bryant, bringing you insightful conversations with experts from around the world who are transforming the way we approach well-being. Hello everyone, today I'm joined with Gigi Robinson. She is a speaker, a content creator, and a voice in the chronic illness space. Gigi has shared her personal journey with endometriosis, and I'm truly honored to have her here with us today. Gigi, thank you very much for being here and for sharing this space with all of us.
Thank you so much for having me today. I appreciate you spotlighting endometriosis. It's so important and powerful and under research. So I'm really glad that you're holding space for this.
You haven't spoken openly about how it took over a decade for you to receive the endometriosis diagnosis. How was for you all this time? Can you walk us through what that journey was like for you?
Yeah, so when I was in my early adolescence, around 10 or 11, I kept getting injured and I kept having a lot of chronic pain. And a lot of the doctors at the time, they suspect I have hypermobile Ehlers-Danlos syndrome. So I went through and I got diagnosed with that. And I thought, okay, great. Now we know what it is causing me pain. Let's just do physical therapy. Let's do anything we can to help me feel better. And I went through, my whole teenage years and my early adulthood and my 20s still having really tremendous chronic pain and not knowing why, and having chronic migraines and having, really, really long migraines with aura, horrible cramps, just pain doing anything, horrible upset stomach, etc. The breaking point for me was that you can have more than one condition and they can exist within another, and they can also trigger or make something worse. But the interesting piece of this was that we were treating my chronic pain, and after a while we were trying all of these different things, and by the time I had tried acupuncture, steroid injection, medication, physical therapy, aqua therapy, yoga, Pilates, like everything I could, my doctor said, okay, I think it's time you try the diagnostic laparoscopy for endometriosis, and we'll see what happens. She said, I think I could suspect you having endo. And I said, okay, fine, I'll try it out. So I tried it out. And when I say tried it out, I went forward and had the surgery. I also had ultrasounds and stuff like that. That's how it happened. But it took a very long time.
All those years with those unanswered symptoms, how they impact your mental health and your relationship with your body and with other people?
Yeah, so I mean, this is many questions in one. I think that having a condition like endometriosis, it's chronic and it's inflammatory. So certain things make it worse. Certain foods make it worse for different people. It's not everyone. Certain exercise makes it worse for different people. So there's still a lot of unknowns when it comes to how endometriosis is diagnosed and treated because it's different in every person. And also, this is my experience, as a patient. I'm not a doctor. So if you do suspect you have endometriosis, please talk to a medical professional. With my, mental health, I think it's hard because there's a certain amount of unknown that's like, okay, well, at least we can still figure out what it is at some point. And then there's a level of once you know, you have all these other things to think about. So, I woke up from surgery and I remember talking with my doctor at my post-op appointment, and she was like, well, we found endometriosis, and if I were you, I would recommend having children by 30. And, I woke up from surgery, I was 24, and I'd never been in a serious relationship before. And so I was like, oh my God, like, this is a lot of pressure out of nowhere. And then to go through the egg freezing process, which I haven't done yet, but to even start talking to the doctors about it, there's a tremendous burden and a tremendous, like, load that is carried when you have a condition that may or may not affect your life plans. And so, I mean, I think therapy is great. I've done a lot of therapy to help me talk through these issues, and also just knowing that my feelings are valid about this. It doesn't really matter if I'm having a bad day about it, because if I'm having a bad day, I'm having a bad day. If I'm having a good day, I'm having a good day. Anybody else's opinions about, living with endometriosis, it's like, well, why don't you live with it and live in the body that is forcing you to live a certain way? And depending on how extreme your case of endo is, I know that your life plans can be severely disrupted. So, I feel lucky that I got it diagnosed so young comparatively to a lot of other people, but also for me, I think knowledge is power. So the more I know, the better I'm able to move through the world. I think that you can learn to live with it and you'll move through it. And, with medical professional help and whatever you can do spiritually to live with this condition that's both painful physically and mentally, it's important.
You just touch a really important phrase. You say that your life or the life of a woman can get really disrupted for the endometriosis, because it can be so severe that some women even can have pain when they are having intimate relationships, and in social relationships too, because when you are feeling bad, you can share your thoughts and or your feelings or your pain with someone, and that people or that person, they don't believe you that you are feeling that way.
Yeah. Something interesting that I just worked on with Dr. David Spiegel, who is a Stanford professor and psychiatrist, and he focuses on hypnosis, self-hypnosis, and hypnosis for chronic pain management. And we're releasing a protocol soon about different ways you can self-hypnotize to help manage your chronic pain. And I asked him the same question you're asking me, which is, in a world where chronic pain, especially if it's invisible, especially if it's a condition like endometriosis or even Ehlers-Danlos syndrome, these are two conditions that frequently doctors say are psychosomatic, it's all in your head. He says, no, the pain is there. The difference is that with self-hypnosis and with pharmacological medication, you turn the dial down on the pain. So the fact that the pain is still there, you're still here in your body, but both can turn the dial down to send the signals to certain areas of your body, right? And so if you go the pharmacological route with pain medication, opioids, etc., you're turning the dial down, but you're actually just stopping the receptors from going to your brain. Versus if you're doing something more holistic, spiritual, with self-hypnosis. So with self-hypnosis, what you're doing is you're turning down the dial by actually accessing a different part in your brain instead of completely shutting it off, which is what pharmacological medication does. And I think it's very fascinating that there's methods to managing your chronic pain. You just have to be open to experiencing it and committed to trying it out. Because how many of us with chronic pain have just been told to meditate or to go be more mindful? Of course. But the focus has to be on the best possible outcome for this to work. So when I did the exercise with him, he said, tell me where you have pain. I said, my lower back. He said, okay, we're going to do this exercise. We did this whole exercise and I was able to get my pain down to like a 1 from like a level 6 just through a short self-hypnosis activity. It really was incredible. I also will have a code for anybody who wants to try his platform out. But for me, it was so refreshing to hear a researcher and a practitioner, somebody who's been researching pain forever, to not invalidate it, but to actually say, being mindful and focusing on this issue with your health is actually like a dial, and you're accessing a different part of your brain. And for me, that was very fascinating, but not once did he say the pain's not actually there, because what's causing the pain? He said, no, if you have a herniated disc or a broken arm, of course the pain is there. But what's sending signals to your brain are the pain receptors. And so are there ways that you can breathe through it, right? What do they have women do when they're giving birth during labor? They have them very specifically breathe to help them through those pain. I think actually we're all a lot more capable of managing our chronic pain than we think.
Yeah, and also I think that it's really important that right now more practitioners, more researchers, they are being more open-minded about this topic, about the pain and chronic inflammatory conditions that can cause pain, because just as you say, maybe some health practitioners, they can tell you, oh no, you are fine. We are not seeing anything in your studies, you are fine. Probably you are stressed and you are anxious. So have someone that is validating your pain, can do something about it.
And I can almost guarantee you that if traditional medicine is not working for you, to go to like a holistic practitioner, like an acupuncturist or a cupping specialist, integrative medicine, and they will have a much broader view on how to help you and not just suggest medication only. And I think knowing how to talk with your doctor is actually a skill that has to be learned.
What do you wish that healthcare providers better understood about the full picture of living with endometriosis beyond just the physical symptoms?
I'm not sure, because I'm not a doctor, I'm not sure when endometriosis starts, or at what point you can tell when you have it, because some women develop it over time, some women develop at a certain period of time and then they heal it, or they get surgery and then it never comes back. Other people have to get a second surgery, third surgery, fourth surgery. So I find that piece really fascinating from a patient lens. It's a little daunting, but the other interesting thing that I think I was thinking about in the couple of years since my diagnosis is the fact that a lot of gynecologists, they don't suspect it based on your symptoms. I also think that they don't talk to patients from a young age. Like, the only reason I went to a gynecologist was when I was like 19 or 20, before I went to college, because I was like not sure when or if I was gonna hook up with people. I find it very interesting that unless you're sexually active, they don't place an emphasis on going. And had I known that bleeding for a certain amount of time while on my period, or filling up a tampon or a pad in a certain amount of time, was normal or was not normal, maybe I would have gotten my pain relief and symptoms diagnosed of endometriosis sooner. So I think there's a big gap in endometriosis education between the doctors that are working with women, when women go to gynecologists, when the gynecologist says, you know what, I think you should go get surgery, go see a gynecological surgeon. I think that is a very big gap. And I wish more doctors would pay attention to that, and also PCP doctors, right? It's their responsibility too to ask these questions of, hey, by the way, how are your periods? Are they light? Are they heavy? Would you say on average you're bleeding through a tampon in 3 hours or in 1 hour? And if the answer is 1 hour, well, that's something to look at. That's something that's pretty well known about endometriosis, is super heavy bleeding. And so maybe had my doctors asked me those questions sooner, I would have gotten diagnosed sooner.
You mentioned before that you were practicing some holistic healing practices. Are there any other healing practices or tools or rituals that have made a real difference for you?
Well, the self-hypnosis thing is like brand new. I just got introduced to this. However, I've been doing acupuncture for years, and the acupuncture really, really helps. Massage therapy helps. Actually, swimming and aqua therapy really helps me too. It's low impact, but you can still get your cardio and your strengthening in with the resistance in the water. I love that, but just being mindful, going to pelvic floor PT as well, I think can be a very stigmatizing kind of thing. But yeah, all of those things helped. And then I have medication in case my symptoms are so bad. I also have lately been doing a daily bath. So daily hot bath time is at the end of my day when I'm tired and just want to kind of unwind and disconnect from my work day to my personal life, after 5 or 6 o'clock in the evening. I draw a hot bath with some Epsom salts or like a muscle relaxing elixir in it. And I sit in the bath for 30 minutes to an hour, and I'll either meditate, sometimes I'll scroll, sometimes I'll read, sometimes I'll edit a video I have to post. Honestly, I'm doing a lot in my daily bath, but I really enjoy it, and it's just really been a nice ritual that I've done. I also have like red light therapy. I personally have never used like castor oil, but I hear people really respond well to that too. I just have not.
Some studies show a correlation between endometriosis and mental health challenges like anxiety, depression, some eating disorders. Have you personally experienced some of these?
I mean, I've never clinically been diagnosed with these issues that you're talking about. However, what I can speak to is living with a chronic illness, whether, pre and post diagnosis of endometriosis, right? I felt a certain way about what was going on in my body. And I didn't always feel good because I couldn't always exercise because I was always feeling fatigued from exercising. And I honestly think it's really beautiful that I'm able to recognize that now, that I was once struggling with what my body looked like and getting upset and obsessive about how my body looked, because I couldn't exercise without feeling like crap, so I didn't exercise. So maybe I restricted food. And then in order to help alleviate my stomach symptoms, which I had for years and years, we didn't know what was going on. And then they found endometriosis on my bowel, and it was like, oh, well, this explains a lot. Changing my food and what I was eating to lower my inflammation level. I know the autoimmune protocol diet is a very specifically recommended diet for people that live with endometriosis. So, going on a restrictive diet can be really hard, and then you can slip up. And then when you slip up, maybe you want to eat a pint of ice cream. And then when you eat a pint of ice cream, you don't feel good. And then you flare up. So I've definitely dealt with that at certain points in my life, but I have a very healthy relationship with food now. I eat when I'm hungry. I don't limit myself. I personally am not a snacker, so I've never been always reaching for a snack in the middle of the day. I like to eat my meals, and that's about it. I also have been, seeking therapy for years. I really enjoy it as like a kind of like me time to just connect and think about certain actions, certain relationships, certain things that either bother me or don't. Sometimes focusing exclusively on chronic pain, why I might have chronic pain in certain areas, thinking about mind-body connection, lived experiences and how it shows up in the body, if you're stressed, where it shows up in the body. And so for me, I would say, I understand if people are diagnosed with these issues, but at the same time, I think, it's kind of like a both and situation where they can live with chronic health issues and still struggle, but you can also persist and you can find like not the beauty in it, but you can survive it. And I think come out on the other side where you have the power and like you're taking your control back, because again, knowledge is power. So the more you know, the better you can handle it. So if you say, I have anxiety and depression and endometriosis and life's so hard and life sucks, that's fine. And you have all of those things. What can you do about it? Well, there's thousands of resources out there for managing anxiety. Which ways do you want to go about it? Also, I think that sometimes our cases can be so severe and we can feel so helpless, and people are like, well, I don't know where to start. And that's where I think the beauty of social media comes in, where they just take to social media to feel something, to realize, wow, like somebody else is dealing with the same thing. I'm not actually as alone as I thought.
Did you mention that the autoimmune elimination diet was helping you to overcome the inflammation?
I've never done that one. I only did FODMAPs in the past, but I was not successful with it. It was not pleasant for me. What's really helped me is eliminating all seed oils, gluten, dairy, and I mostly eat fresh, organic food that I'm cooking here in my house. Occasionally I'll go out to eat, but I am very specific with what I eat. You know, I limit my nightshade vegetables, so I don't eat as many like tomatoes or eggplants and peppers. You know, garlic and onions and beans, it causes gas, but usually it doesn't hurt my stomach. I do a lot of like legumes, like lentils. I think more something that resonates more with me than any of these diets though is like the Ayurvedic eating. I find that to be a lot easier on the stomach and cause me the least amount of trouble.
So, at what point did you decide to turn your personal experience into advocacy?
Well, I think I was dealing with a lot of issues in college where people weren't believing me, whether that was a teacher or a friend. Mostly my doctors have always believed me, luckily, but a lot of the time it's more those personal relationships in your day-to-day life, like at school or in your life with friends, or with, you know, the people you date, that make you feel the worst. And I got an art degree, and the number one thing they teach you in art school is show, don't tell. So how can you show what you're going through and not tell people what you're going through? And I figured, okay, well, I guess let me try this out and let me try to show people. So I brought my camera with me to my doctor's appointments, and I made a very clear intention to start posting about it in Facebook groups and on my social media pages to share my experience. And as I was doing that, it kind of just grew from there. So maybe that was like 2019.
And how was this experience for you? I mean, show, don't tell. How does it feel for you?
Well, I think, you know, I got an art degree, so I was very focused on explaining my experience without using words. So, for example, anytime you go to the doctor and you go to sit down on the chair, you know, there's a certain kind of rubber that they put on the chair that you sit on. And almost everybody knows that there's a slight reflection from the lights above that are slightly fluorescent, and the lights above and the panels on the ceiling are usually white panels with like a white metal around it, and it's a fluorescent light beaming down into the room, and then there's usually a crinkled paper on top. So everything that I'm saying to you, I believe, is a universal experience when people go to the doctor. At least here in the United States, it's pretty standard, whether you're going to a holistic practitioner or a traditional Western doctor. The way that I captured that was through details, through color studies, through sound studies, focusing on what are these common experiences that I'm seeing. The sound that the blood pressure monitor makes, the sound that the heart rate monitor makes, the color of the bin with all of like the needles from the blood draws and the flu vaccines, right? What does that look like? What color are you thinking of? Are you thinking of a tan box? Are you thinking of a red box? Are you thinking of a yellow box? Because at least here, usually they're those colors. And so really walking people through that. I actually, on this call, you can see this book right here was my thesis book where I talked about that. And then that's what I did. That's how I helped people through it.
So you are practicing awareness.
Yeah.
And what has been one of the most meaningful responses that you have received from someone who connected with your story?
I don't have a specific example for you, unfortunately, but I do get messages all the time. Something recently that happened, I was the closing keynote speaker at the Endometriosis Foundation Patient Day, and I actually decided not to do a keynote to talk about my story, but a session to help people tune into mindfulness and have a moment of like compassion. So while I was on the stage, and there's a video of it that exists out there, but while I was on the stage, I was leading everyone through meditation, helping them, learn how to be more grounded and thinking about the things you do for somebody that you would love. And then I kind of flipped it around and said, how many of you in this room would do any of those things for yourself? And I think 2 people out of like 150 people raised their hands. And I remember during this meditation, I was, guiding people through this journey, and they were crying and tearing up, and they were present and they were willing to follow through. And I think that that was extremely moving, because I realized not only did people get moved by this, but they also needed this. And the moment to reflect and think about, I show up so much for other people, why can't I do it for myself, is also a really emotional thing. And so in the video of me while I'm doing this, you'll see my chest gets bright red, because I all of a sudden saw people tearing up in the audience, and I'm like, did I do something wrong? And then people came up to me and said, no, this was really beautiful, the way that you orchestrated this, and had a moment to just breathe at the end of the day. And it was only a 7-minute talk, but yeah, it was really beautiful.
What are those practices that you will recommend to the people to do every day for themselves?
Whatever works for you. Like it's honestly different for every single person. What works for me is not necessarily going to work for you. I live in New York City, and New York City is very high maintenance and busy, and there's a lot going on. And so for me, I do my best to do the things that work for me to ground me. But that might not work for other people. If what works for me is a cold shower and what works for you is a hot bath, you're not going to go and do a cold shower if you love hot baths. So I think finding out and testing those things on your own, and I've tried a lot of things, is important, but I also think being open to trying something new is important, which is, again, what I talked about before with Dr. Spiegel for Reverie, is the fact that I was open to a self-hypnosis session to see what could happen. I told him on the call while we're filming, I was like, Dr. Spiegel, I have tried just about everything. And because I've tried just about everything, I'll try another thing. I'll just do it. Why not? And I think people, when they have health issues, sometimes can get so stuck in, well, this is the only thing that works. The medication is the only thing that works. I can't live without my medication. For me, I'm like, I can't live without therapy. I'm like, I can't live without acupuncture. Like, those things really help me. I can't live eating out, eating whatever I want. I have to meal prep. I have to eat whatever I want. Like, specifically what I need to eat is different than what I want to eat. Do I want to eat cookies and brownies and a cheeseburger and French fries? Yes. But do I also know that getting a burger in a lettuce wrap with no dairy and no tomatoes is going to make me feel better than if I did get the burger with the bun, with the cheese and the French fries instead of a side salad? Yeah, but I'm also not saying don't go and get the fries if you want to eat some French fries. I mean, sometimes I do walk by the store and I just buy some French fries. So, it just depends on you and what your goals are, and like what you want.
Why do you think that people that is going through their healing process sometimes are afraid to try new things? As you said, you need to open your mind and be willing to try new things if you want to improve your health situation.
I don't know if this is a good answer, but go to therapy. If you are so stuck in your ways that you won't try anything new, I guess my question back would be, why? instead of a scarcity mindset of I don't want to try anything new, breathing and breath work, it's free. You don't have to pay anyone for it. Changing what you eat, right? You can look up different recipes and things that exist to help you eat on a specific diet. And if you say, well, I still want to eat my burger and my fries, well, that's your choice. You know that it doesn't make you feel good. And so the second that you make the decision to have the power over your choices is the power that I believe you'll take back to become empowered to make decisions that are more aligned with your health goals, that will help you heal. Another example is going to the gym. Do you want to go to the gym? Do any of us want to go to the gym? Or do we force ourselves to go to the gym because we know we're going to feel better after? That's the mindset that I think people who are hesitant to try something new should have when they are experimenting and trying new things. For me, I've tried HIIT classes, yoga, Pilates, aqua therapy, weight training, running. I've tried all these things, cycling. I know what works for me is yoga, Pilates, and aqua therapy. That's what works. I'm not going to go for a run because I know going for a run is physically not aligned. So I've tried running and I've noticed, I don't really feel as good after that as I did when I did yoga. And if you want, you could just keep a journal or jot it down or put a note or go into ChatGPT and make a chat of all of your exercise routines that you're doing and test it out, because I think people tend to overcomplicate, and that's fine, but people tend to overcomplicate as a means of procrastination.
You would like to share something else about your story and about your journey?
Oh, I think I'm happy about it. I also think, for me, sharing about my journey was important because I knew I was going to help other women feel less alone, feel less lost in the process, have their feelings validated, but maybe don't have the access or the resources to therapy, or they may not know how to ask the right questions to get their doctor to consider the laparoscopic surgery. And really what you have to do in order to get there is ask the right questions and go through, unfortunately, a lot of different testing in order to get there. I mean, I believe you need like an MRI and an ultrasound, and then you'll go into surgery. A lot of the time they won't just jump straight into surgery because they want to be sure that you are a good candidate for the surgery. And there are doctors that I've heard of, at least, that will reject patients who they don't think are a good candidate. All that to say, I think seeking separate opinions is also very valid and valuable. For example, I saw 3 different doctors before deciding on the doctor I wanted to go with, which was the 3rd doctor. So I think, seeking opinions, also talking with, people about their experience with their cycles and whatnot is important, as long as they are, really there.
Gigi, for someone who might have endometriosis but doesn't feel heard, what words would you give them?
I would say if you suspect you have endometriosis or you're living with it, it doesn't matter. Again, be open-minded to different ways of altering your lifestyle to help you best manage your life and your health issues.
You are also a content creator and a speaker and an entrepreneur. So for those who wants to stay connected with you, where they can find you?
You can Google me, Gigi Robinson. You can message me on Instagram or LinkedIn or TikTok. So yeah, definitely feel free to follow along.
Gigi, thank you so much for sharing your journey with us today. Your story is a reminder of how essential it is to listen to our bodies. And if we are not feeling well, we just need to speak up, even when it's hard.
Yeah, absolutely. And I think speaking up is the most important, powerful thing you can do.
And for everyone listening, just remember that you are not alone. And doesn't matter what kind of health issue you are dealing with, you can get better and you can improve. If you think that someone else needs to listen this message or this episode can improve the life of someone, please share it with that person. Thank you for being part of this space. See you next time on the Two Healers podcast.